Welcome, everyone, to the OphthoKnight quiz show, the ultimate interactive challenge for ophthalmologists from around the world. Test your knowledge, compete, and win. Every week, we go live with a fast-paced, high-energy ophthalmology quiz. You'll face real clinical scenarios, rapid spot diagnoses, and investigative decision-making, putting your practical ophthalmology skills to the ultimate test. Compete against ophthalmologists worldwide in a quiz that's fast, challenging, and fully interactive. Here's how it works. Answer in the comments using only the number 1, 2, 3, or 4. Only one answer per question counts. Multiple submissions will be disqualified. Answer quickly. Don't wait for the full question to be read. The winner is the one with the most correct and fastest answers. Over the past weeks, hundreds of outstanding ophthalmologists have joined our quiz. Here are some of our brilliant winners. Look at those scores. Incredible work. And heartfelt congratulations to our champions. Maybe next time, it'll be you. Winners also receive a symbolic gift, but the real reward is sharpening your ophthalmology skills and competing with the very best. Are you ready to take the challenge? Subscribe to OphthoKnight, join the live quiz, and maybe your name will be the next on our winner's board. We go live every Friday at 11:30 p.m. Cairo time. To join, simply subscribe, turn on notifications, and be ready when the quiz begins. All you need is your knowledge and your speed. Join us live and see if you have what it takes to become the next OphthoKnight champion.
Welcome, everyone, to our live trivia show. Get ready to put your knowledge to the test in the fascinating world of ophthalmology, the branch of medicine that focuses on the eye, its structure, function, and a wide range of eye diseases. Today, you'll face 25 multiple-choice questions. Each has 4 answer options, but only one is correct. The faster you respond, the more points you earn. To answer, simply comment the number of the correct option or type the full answer. Eyes may be small, but their mysteries are vast. Let's explore them together. Remember, 25 questions, 4 choices, speed matters, comment number or full answer. Here comes question number 1. Angular conjunctivitis is caused by 1. Moraxella, 2. Haemophilus, 3. Bacteroids, 4. Adenovirus. Drop your answer, number or full name. Eyes on the prize, let's go. Angular conjunctivitis often affects the eye corners, commonly seen in chronic cases. Correct answer, Moraxella. 36 out of 36 nailed it. Shout out to Ahmed, Usama, Dr. Shima. Question 2 coming your way. Herbert's pits are seen in which condition? 1. Trachoma, 2. Flectinular keratoconjunctivitis, 3. Allergic conjunctivitis, 4. Adenoviral conjunctivitis. Think carefully, eye diseases can be tricky. Lock in your answers now, everyone. Herbert's pits are small depressions near limbus and scarring. Correct answer, trachoma. 38 out of 39 answered correctly. Well done Ahmed, Fatma, Hiba, Usama. Here comes question 3. Donor cornea is harvested after what time from death? 1. 6 hours, 2. 3 hours, 3. 2 days, 4. 16 hours. Eyes on the clock, tick-tock. Submit your answers now, everyone. Corneas must be harvested quickly to preserve tissue viability after death. Correct answer, 6 hours. 30 out of 44 got it right. Great job Waima, Mr. Native, Muhammad, Romy. Time for question 4. Signs of graft rejection are all except 1. Kratchmer's spots, 2. Coated outline, 3. Graft edema, 4. Foster's spots. Think carefully, one doesn't belong here. Lock in your answers now, folks. Coated outline indicates endothelial rejection in corneal graft patients. Watch for it. Correct answer, Foster spots. Well done. 33 of 44 nailed it perfectly. Shout out Ahmed, Usama, El Adai, Shima. Here comes question 5. Focus up, everyone. When should a type 2 diabetic with no complications undergo ophthalmic evaluation? 1. As early as possible. 2. After 5 years. 3. After 10 years. 4. After 1 year. Think timing, eyesight matters. Lock in your answers now. Diabetic retinopathy can develop without symptoms. Early screening is absolutely essential. Correct answer, as early as possible. 23 of 50 players answered correctly. Nice. Usama, Mostafa, Ahmed, Ribbon AIA Ribbon, great job. Time for question 6. Ready those brains. Schaefer's sign is seen in which condition? 1. Stargardt's disease. 2. Retinal detachment. 3. Iridocyclitis. 4. Congenital glaucoma. Think carefully. This one tests your clinical observation skills. Schaefer's sign indicates pigment cells in vitreous. Think retinal issues. Correct answer, retinal detachment. Well done, everyone. 38 of 48 players got it right. Safe, Mr. Native, Usama, Ahmed, great job. Here comes question 7. Get ready to focus. Miswa-Nakamura phenomenon is seen in 1. Retinitis pigmentosa. 2. Oguchi's disease. 3. Fundus flavomaculatus. 4. Fundus albipunctatus. Think carefully. This rare sign has a shimmering golden twist. Miswa-Nakamura sign disappears in dark adaptation. Fascinating visual transformation. Correct answer, Oguchi's disease. Nicely done, everyone. 43 of 47 players answered correctly. Impressive. Safe, Mostafa, Shima, Hiba, great work. Question 8 coming up. Put on your clinical thinking caps. A 5-year-old boy has bilateral retinoblastoma. Right eye advanced, left eye has small peripheral lesions. What's the best management approach here? 1. 6 cycles of chemotherapy. 2. Radiotherapy. 3. Enucleation right, focal therapy left. 4. Enucleation of both eyes. Tough case, think carefully, vision and life both matter. Retinoblastoma is the most common intraocular tumor in children. Early detection saves vision. Correct answer, enucleation and focal therapy. Well done. 42 of 46 players got it right. Mostafa, Ahmed, Usama, excellent clinical thinking, team. Here comes question 9. Ready your diagnostic instincts, everyone. A 6-year-old boy has decreased vision left eye. Right eye's fine, but left shows exudation, telangiectatic vessels. What's the likely diagnosis here? 1. Retinal artery macroaneurysm. 2. PHPV. 3. Eales disease. 4. Coats disease. Think carefully, vascular clues can lead to the right answer. Coats disease often presents in young boys with unilateral vision loss and exudation. Correct answer, Coats disease. Great clinical reasoning. 48 of 50 players nailed it. Shout out to Hamida, Iman, Ahmed, Saif, brilliant work. Time for question 10. Let's test your optics knowledge. Look at the instrument shown here. What magnification does it provide when viewing the retina? 1. No magnification. 2. 5 times. 3. 3 times. 4. 15 times. Focus in. Precision matters when it comes to retinal imaging. The retina converts light into signals your brain understands. Amazing, right? Correct answer, 15 times. Excellent optical knowledge. 43 of 47 players got it right. Kudos to Rehab, Saif, Radwa, Mostafa, well done. Let's move to question 11. Eyes wide open, everyone. Second sight phenomenon is seen in 1. Posterior subcapsular cataract. 2. Nuclear cataract. 3. Mature cataract. 4. Cortical cataract. Trust your instincts. Sometimes vision gets better before it gets worse. Second sight can temporarily improve near vision in aging eyes. Fascinating, right? Correct answer, nuclear cataract. Great job, everyone. 43 of 47 players answered correctly. Impressive. Shout out to Lamar, Saif, Ahmed, Mohammed. Well done. Here comes question 12. Let's keep those scores climbing. Rosette cataract is seen in 1. Wilson's disease. 2. Myopia. 3. Diabetes. 4. Blunt trauma. Think fast. Roses in the eye? Sounds dramatic, doesn't it? Rosette cataracts often form after trauma, named for their flower-like shape. Fascinating, right? Correct answer, blunt trauma. Nicely done, everyone. 45 of 52 players got it right. Shout out to Mustafa, Ahmed, Usama, Mohammed, great job. Lucky number 13, let's keep that momentum going. Vasius ring is seen in 1. Rubella, 2. Iridocyclitis, 3. Concussion injury, 4. Acute angle closure glaucoma. Eyes leave clues. Can you spot the right one? Answer now. Vasius ring appears as a pigment imprint on the lens capsule. Correct answer, concussion injury. Well played, everyone. 41 of 48 players nailed it. Shout out to Yo, Mustafa, Lamar, Mohammed, awesome work. Question 14 coming at you, eyes on the prize. Most common ocular lesion in HIV. 1. Kaposi sarcoma. 2. Cotton wool spots. 3. Choroiditis. 4. CMV retinitis. Think fast, vision matters. Lock in your answers now. Cotton wool spots indicate retinal nerve fiber layer microinfarctions, often seen in HIV. Correct answer, cotton wool spots. Nice job. 14 of 52 players got it. Shout out to Yo, Safe, Mohammed, Lamar, well done. Question 15, let's light up your memory. Headlight and fog appearances seen in 1. Tuberculosis, 2. Toxoplasmosis, 3. Sarcoidosis, 4. CMV retinitis. Eyes wide open, submit your answers now, folks. Toxoplasmosis can cause retinal lesions resembling headlights shining through fog. Correct answer, toxoplasmosis. Great job, everyone. 48 of 50 players nailed it. Shout out, Mohammed, Usama, Safe, Mustafa, well played. Question 16 coming in, ready those brains. First line management of primary uveal effusion syndrome is 1. Systemic corticosteroids, 2. Partial thickness sclerectomy, 3. Pars plana vitrectomy, 4. Panretinal photocoagulation. Think carefully, this one stumps many. Lock in answers. Uveal effusion often involves abnormal scleral thickness and fluid buildup. Fascinating condition. Correct answer, partial thickness sclerectomy. Well done. Only 8 of 50 answered correctly. Kudos, Mustafa, Sama, Ahmed, Mahmood, great job. Question 17, let's test your clinical instincts. An HIV-positive patient, low CD4, sudden vision loss. What's the likely diagnosis from fundus findings? 1. Pneumocystis carinii choroiditis. 2. HIV vasculopathy. 3. Candida endophthalmitis. 4. CMV retinitis. Eyes on the prize, lock in your answers now. CMV retinitis often shows fluffy white lesions with retinal hemorrhages, classic appearance. Correct answer, CMV retinitis, great clinical thinking. 38 of 49 players got it right. Shout out to Yo, Iman, Safe, Mustafa, impressive. Question 18, optics lovers, this one's for you. When refining cylinder axis using JCC, where should the handle be placed? 1. Perpendicular to correcting cylinder axis. 2. Parallel to correcting cylinder axis. 3. At 45 degrees to axis. 4. Arbitrary position. Focus in, lock your answers now, precision matters. JCC stands for Jackson Cross Cylinder, used in refining astigmatism correction precisely. Correct answer, parallel to correcting cylinder axis. Only 4 of 46 players nailed it. Kudos Magico, Mustafa, Dr. Mahmood, no adverse 1. Question 19. Time to identify that mystery instrument. Look closely at the picture shown. What's it used for? Choose wisely. 1. Syringing. 2. Probing lacrimal drainage pathway. 3. None of the above. 4. Dilatation of the punctum. Eyes on the prize, submit your answers now. The lacrimal system drains tears from the eye into the nose. Correct answer, probing of lacrimal drainage pathway. Impressive. 42 of 51 players got it. Shout out to Lamar, Native, Maha, Ahmed, brilliant. Question 20. Let's test your neuro-ophthalmology knowledge. Visual loss from cerebral degeneration. What's the cause? Which artery's territory is responsible? 1. Posterior communicating artery. 2. Posterior cerebral artery. 3. Middle cerebral artery. 4. Anterior cerebral artery. Think fast. Your brain knows this answer. The posterior cerebral artery supplies the brain's visual processing center. Important stuff. Correct answer, posterior cerebral artery. Well done. 41 of 51 players nailed it. Shout out, Ahmed, Mustafa, Adele, Safe, great job. Question 21. Let's dive into neuroanatomy again. Wernicke's hemionopic pupil is due to lesion in 1. Optic tract. 2. Optic radiation. 3. Optic chiasma. 4. Lateral geniculate body. Eyes on the prize, lock in your answers now. The lateral geniculate body relays visual signals from retina to cortex. Correct answer, optic tract. Great job, everyone. 14 of 46 players answered correctly. Shout out, Iman, Native, Mustafa, Sama, well played. Question 22. Time to test your pharmacology knowledge. Which drug combo isn't typically used in glaucoma? 1. Timolol plus pilocarpine. 2. Timolol plus latanoprost. 3. Timolol plus brimonidine. 4. Pilocarpine plus latanoprost. Think carefully, some combos are more common than others. Pilocarpine works by increasing fluid drainage to lower eye pressure. Correct answer, pilocarpine plus latanoprost. Well done. 37 of 53 players got it right. Shout out to Ahmed, Amal, Native, Ahmed, great job. Question 23. Look closely at the picture test. What is it evaluating exactly? 1. Suppression. 2. Stereopsis. 3. Phoria. 4. Abnormal retinal correspondence. Trust your vision instincts. Lock in your answers now. Stereopsis helps us perceive depth using both eyes together. Pretty amazing, right? Correct answer is stereopsis. Great visual skills. 50 of 52 players answered correctly. Shout out, Mohammed, Ahmed, Saif, Hamida, well done. Question 24. Let's test your squint knowledge. Which type shows greater secondary deviation? 1. Restrictive squint. 2. Paralytic squint. 3. Concomitant squint. 4. Accommodative esotropia. Eyes on the prize. Submit your answers now. Paralytic squint often results from nerve damage affecting eye movement control. Correct answer, paralytic squint, great clinical insight. 38 of 52 players answered correctly. Shout out to Lamar, Yo, Mustafa, impressive work. Final question, look closely at the image. From the picture, estimate the squint grade. 1. 45 degrees esotropia. 2. 30 degrees exotropia. 3. 30 degrees esotropia. 4. 15 degrees esotropia. Trust your eyes, lock in your answers now. Esotropia means inward turning of one or both eyes, common in children. Correct answer, 15 degrees esotropia, well done. 34 of 50 players got it right. Kudos to Lamar, Mr. Native, Ahmed, great job. Mustafa Ashraf takes the crown with 24 correct answers, amazing performance. Huge congrats to all top scorers. Thanks to all 63 players, what a fantastic trivia journey. See you next time, Trivia Champs.